Hey mamas, as most of you know, during pregnancy there are several screenings or those little tests done to ensure that you and your baby are healthy. And one of those screenings is for Group Beta Streptococcus or GBS. While there are medical ways to make sure you and your baby stay healthy if you are GBS positive, there are also things you can do to help prevent getting GBS. And after this video, you'll know what GBS is, how to prevent yourself from getting it, and what to do if you are GBS positive. I'm Bridget, and I'm a birth doula in the San Francisco Bay Area, and I love helping moms love their birth. To learn more about how to have an empowering experience through your pregnancy, birth, and postpartum, make sure you're subscribed to my channel and have hit the little bell next to it so you don't miss anything in the future. All right, so what is GBS? Well, Group B Streptococcus, GBS, is a type of bacteria that is naturally found in the digestive system and the lower reproductive tracts of both men and women. It is not an STD. It doesn't mean you're sick. In fact, you can get GBS from your water, your food, or touching something and then not washing your hands. And basically what happens is that GBS colonizes in your gut and then travels down to the intestines, to the rectum, and then to the vagina. Now, typically this bacteria is not dangerous to people who have healthy immune systems, such as yourself, mama, but it can pose potential risk to your baby who still has an immature immune system, which is why pregnant women are screened for it toward the end of their pregnancy. Now, most of the time, if you are GBS positive, you won't experience any symptoms. In fact, about 1 in 4 pregnant women carry GBS and don't even know it until they are screened for it at about 35 to 37 weeks. So when you're screened for GBS, what your doctor will do is swab your vagina down to your rectum and then send that off to the lab for results. So don't worry, it's not too invasive of a test. So if that test comes back positive, it won't affect your physical health. However, if during birth, as baby is making their way out of the birth canal that has been now colonized by GBS, and then baby becomes infected, it can possibly cause infection in the brain, pneumonia, or sepsis. Now, I know that sounds scary, but thankfully that doesn't occur very often. Your baby may even become colonized by GBS, which happens about 50% of the time when mama doesn't receive the antibiotics, and baby stays completely healthy, compared to the only 1 to 2% of babies who actually become infected, causing risk of a serious illness. But still, those aren't necessarily risks you want to take if it means your baby could be left with a brain injury or even death. So because of this, if at 35 to 37 weeks you're screened and the GBS test comes back positive, you'll likely get IV antibiotics during the onset of labor. So what this does is that it kills off that GBS bacteria so that baby is not as much at risk for contracting the bacteria while they're being born. When mama does get the antibiotics administered, those 1 to 2% risks for serious illness drops to 0.2%, making it very unlikely that your baby becomes infected, which is really, really good news. Now, interestingly enough, GBS can sort of come and go. So just because you test positive for it at 35 weeks doesn't necessarily mean you'll have it when baby is born, and vice versa. If you test negative for GBS at 35 weeks, there is a chance it could present itself later on. So because GBS can sort of come and go on its own, it makes us think there may be ways to prevent it from colonizing in the first place, and that is what we're going to talk about right now. Now, because GBS is a bacteria that develops in the gut, it makes sense that a healthy gut will be very important in preventing GBS. So the first thing I want to talk about is a healthy diet full of fruits and vegetables, along with high amounts of probiotics. So I'm going to get a little bit sciencey on you, but probiotics are microbes that have been shown to promote health in humans by populating the presence of good bacteria in the gut, which allows you to digest your food, eliminate waste, and produce those necessary nutrients for your body to thrive. So the first thing that you can do to prevent GBS is to start taking a probiotic at the beginning of your pregnancy. Honestly, you can take probiotics whenever because they're going to be beneficial pretty much during all seasons of life. But as always, talk to your care provider if you have a special situation during your pregnancy that may cause adverse reactions to a probiotic. So along with taking the probiotic orally, you can also open the capsule and sprinkle the contents on a panty liner that will sit in your underwear. And doing this allows that probiotic to have a more direct access to the GBS in your vagina, which is going to help increase the number of good bacteria. Using probiotics is one of the most researched methods of managing GBS aside from using antibiotics. Now, probiotics are going to work best when you are eating a balanced diet, which means lots of fruits and vegetables, like I said, some meats, unprocessed whole grains, and good fats. And you really do want to try to stay away from eating too many sweets and junk foods because it makes the blood in your body acidic, which is basically a breeding ground for bacteria. Now, a specific food that I want to mention that will help prevent GBS is garlic. Garlic doesn't just make your food taste good, but also has antibacterial properties that can help with eliminating that unwanted bacteria and promoting good bacteria growth. So eating a raw clove of garlic once a day will actually be the most beneficial way for you to consume garlic, but you can also take it in capsule form because I know it's a little bit easier to take, and I will link the capsule form in the descriptions below. One last thing about garlic and a little pro tip for you is to crush it and not chew it so that your breath isn't quite so stinky afterward. So to add on to taking a probiotic and eating healthy, a strong immune system will help fight off the GBS bacteria. So taking vitamin C supplements every day can help your body do that, along with eating those fruits and veggies such as oranges, broccoli, bell peppers, tomatoes, and berries, all of those things that have lots of vitamin C and lots of antioxidants. So all of those foods, along with garlic, are going to really help boost your immune system. And another upside to having a strong immune system is that it not only helps prevent GBS, but it can also keep you nice and healthy during your pregnancy. The last thing I want to mention to you about preventing GBS, but certainly not the least, is zinc. So zinc deficiency has recently started being researched by the National Institute of Health in relation to preterm birth by the cause of intrauterine infections such as GBS. And their research is showing that pregnant women who are deficient in that micronutrient zinc are more at risk for developing GBS. So with that in mind, we can look at the flip side and say that with adequate amounts of zinc, Group B Strep could potentially be avoided. Now, the WHO estimates that 80% of women worldwide are deficient in zinc. So to make sure that you are consuming enough zinc, focus again on eating foods that contain it, such as red meats, shellfish, nuts, seeds, and guess what? Even dark chocolate. And of course, you want to make sure you eat everything in that list in moderation, especially when it comes to that red meat, shellfish, and dark chocolate. And if you feel like you can't eat all the right foods to get enough zinc, then you can also take it in capsule form, which I will link in the descriptions below. Again, before you use any kind of supplement, you want to make sure you're talking to your doctor about it to make sure that it's safe for you. And also, you may already have zinc in your prenatal vitamins, so take a look on the back of that label to see if you do. So all of those things can help avoid a positive GBS test, and if it does, it's important to continue that regimen to the end of your pregnancy to make sure you don't develop GBS after your test is taken. Now, if you find out that you're GBS positive, your care provider will want to administer IV antibiotics about every 4 hours during labor, and they usually want at least 1 round of antibiotics in your system before baby is born. Now, to some of you, having an IV stuck in your arm may sound a little bit miserable during labor, but just because you need to have antibiotics doesn't mean you have to stay connected to that IV the whole time. You can get a saline lock so that after the antibiotics have been given, you can take it off and you can move around a little bit more freely. Now, keep in mind that antibiotics do a really good job of killing that unwanted bacteria such as GBS that helps protect your baby, but it also unfortunately attacks good bacteria too that baby gets as they go through the birth canal. Those antibiotics aren't just affecting mama, but they're also affecting baby, and sometimes it causes them to have diarrhea, nausea, and stomach pain, and it can make them more susceptible to germs that will make them sick, because again, those antibiotics are getting rid of the good gut flora or bacteria as well as the bad, and that healthy gut flora or bacteria is what helps your body stay healthy. So what can you be doing to make sure that your baby can stay as healthy as possible while also getting those antibiotics that they need to protect them from their GBS? So most importantly, you want to breastfeed early and often after birth, and then as long as possible or for at least 3 months. This is going to help your baby tremendously as their microbiome or their gut bacteria regrows. Also, you can keep taking probiotics that will pass into your breast milk that baby will drink, or even talk to your baby's pediatrician about giving them probiotics directly. In the long run, this can help prevent asthma, allergies, and general illness. So it's a good idea to think about and possibly discuss with the pediatrician if it comes to that. This video had a lot of information in it, and I hope it helps you understand one of the several screenings you'll likely get in your pregnancy, as well as how to possibly prevent GBS in the first place. Remember, GBS is not a sickness or something you need to be scared about, but more of a small bump in the road that if you see coming isn't so abrupt. So thanks for being with me in this video, Mama, and I will see you in the next one.